My Lords, as I indicated earlier, retaining Clause 77 would have several substantial benefits. The OFT already has jurisdiction to review foundation trust mergers under the Enterprise Act. The problem is, as I've said, there's legal uncertainty as to when this applies in individual cases. That creates the risk of double jeopardy for foundation trusts, as their mergers are also reviewed by the Cooperation and Competition Panel. And there's also a problem of unnecessary duplication of specialist skills between the Cooperation and Competition Panel and the OFT, which incidentally brings with it a cost to the UK taxpayer. Retaining Clause 77 would avoid this duplication and eliminate the current legal uncertainty and risk of double jeopardy for foundation trusts. And this would encompass mergers between two or more foundation trusts and acquisitions by a foundation trust of another foundation trust or a private business, such as UCLH's acquisition of the London Heart Hospital under the previous administration. However, I think it's important for me to make this clear. The bill would prevent any takeover of a foundation trust by a private company, contrary to what some commentators outside this House have suggested. Secondly, the OFT has a proven track record for light touch, proportionate regulation of mergers and ensuring good value for public money. By contrast, under the system we inherited from the previous government, the Cooperation and Competition Panel has reviewed several mergers of community services at considerable cost and delay to the NHS that would have been permitted automatically under the OFT's materiality thresholds. Finally, the approach provides better value for public money by avoiding duplication of specialist resources between the OFT and Monitor. Mergers are a specialist area. Given the variable frequency of mergers in the NHS, it would really be a far better use of resources to consolidate the responsibility and expertise within the OFT, where it can also be put to good work for the benefit of the wider economy, rather than resource another public body at the taxpayer's expense. I can reassure the House that the paramount consideration for the OFT in reviewing foundation trust mergers would be the impact on patients' interests. This would include, as a matter of necessity, considering the interests of patients in securing sustainable access to a comprehensive health service. As part of any merger investigation, the OFT and Competition Commission would engage with Monitor in order better to understand the services involved. In particular, the OFT would obtain Monitor's view on how a merger would benefit patients. These views would then be considered in the analysis along with representations from other stakeholders, including local health and well-being boards and any other evidence. However, I do sympathise with concerns to ensure Monitor's involvement in advising the OFT and that this should be included on the face of the bill. Amendment 184, proposed by my noble friend Lord Clement Jones, would ensure that evidence gathered in reviewing a merger involving a foundation trust would always include expert advice from a healthcare regulator with an overriding duty to protect and promote patients' interests. I would like to thank my noble friend for what I think is an elegant solution. And I hope that it will allay any concerns that remain in the House in this area. I'm pleased to tell him I plan to support Amendment 184 as and when he comes to move it. I hope, in the light of those reassurances, the noble Baroness, noble Lord Beecham, will feel able to withdraw his amendment.